Good day. Today I'd like to talk about another activity that we can do to promote our health, and that is immunization. So I think many of us will be familiar already with immunizations, childhood immunizations especially, because most countries have different childhood immunization protocols. I know that these protocols and these campaigns, they've been quite successful in pushing back against a number of deadly conditions that used to be quite common in many decades ago. Conditions like polio, conditions like tetanus, they've all been rolled back thanks to immunizations. So it's important for parents to ensure that their children get their childhood vaccines. There are some other promising vaccines for protecting children, like the malaria vaccine, which is also being rolled out currently. It's good to take advantage of them. But immunizations don't just stop during childhood, but even into adulthood. There are vaccines we can take to protect ourselves from certain conditions. Some of the newer ones are the Gardasil vaccine, which helps to protect us against the human papilloma virus, which is the virus implicated in cervical cancer that mainly affects women. So this vaccine is actually given to teenage girls and teenage boys. Some other vaccinations, are vaccines against hepatitis A, vaccines against hepatitis B especially. I hear that hepatitis B is also quite popular in our country now. So one good way to protect ourselves from hepatitis B is with immunization. It would interest you to note too that there is immunization against typhoid. So whereas many of us we just treat ourselves for typhoid every other week or every other month, when there is a vaccine that you could take and to give you some protection, and when you really walk the maths, it's actually cheaper to be immunized. Because it gives you protection for a couple of years. So I would say speak to your doctor about the vaccinations you may be eligible for, and take advantage of this very important health promoting activity. The other thing to know about are your numbers. So there's some critical numbers to know when it comes to your health. You're supposed to know your height, you're supposed to know your weight, you're supposed to know your blood pressure, you're supposed to know your blood sugar. Even in blood sugar, there's another test called the HbA1c, especially for people who have diabetes. It's important to know what your HbA1c is. And for some persons as well, especially people who are above 35, cholesterol becomes a problem as we get older. So it's important to also know your cholesterol levels. So it would be great if we could pay attention to these numbers and if we could take advantage of immunizations. Thank you. My name is Elvis, and I'm a specialty general practitioner. My practice straddles Australia and Nigeria. Thanks for listening. Bye.